More than 50% of rural hospitals in New York are in financial distress and at risk of closure. That's according to a national healthcare group. But as News 10 NBC investigative reporter Jennifer Lukey shows us, Thompson Health in Canandaigua is bucking the trend.
You can see behind me the entire front entrance of Thompson here is under construction, and inside they're expanding as well.
I sat down with the CEO to see how his hospital continues to grow in a climate where many may shudder. Part of it comes down to location. Thompson is in a more affluent rural area where people are willing to donate. But part of it also comes down to population.
We're very fortunate here in Ontario County that Farmington and Victor are two of the only growing communities, I think, in the entire state. A lot of young families are coming in. We all know in our business it's the female head of household who makes the healthcare decisions, so we want her engaged with us as a health system as soon as possible.
That's why the hospital is expanding the birthing center right now and adding new imaging services. And that's just the start.
We, in a couple years, are hoping to build a brand new expansion because we are so busy. We're boarding every day. We want to build an additional 18-bed unit and an 8-bed progressive care unit.
It used to be that patients started at a rural hospital and would need to be transferred to a bigger medical center. But during the pandemic, the opposite was happening, and that model continues to hold here.
We opened up the new ICU 5 years ago, which having that higher level to take care of that higher acuity patient, that's one of the big things that has led to our success, because these were patients before that we were having to transfer to Rochester, transfer to Strong and Highland, that we now keep here.
There's also another big reason why Thompson Health is bucking the trend, and it has to do with the UR that was put in front of its name more than a decade ago.
Plain and simple, we wouldn't be here without the University of Rochester. We wouldn't even be having this conversation. I mean, pretty much every single community hospital I know now has joined with an academic medical center or a larger tertiary facility. You have to.
The CEO here at Thompson tells me the thing that still keeps him up at night is the lack of long-term care beds that are available in our entire region. There's actually a nursing home attached to this hospital. It's right there in the background, but it's consistently at 99% capacity, and the demand just continues to grow. In Canandaigua, Jennifer Lukey, News 10 NBC.
The CEO told Jen it's a little too early to tell how much of an impact the cuts to Medicaid will have locally, as most of them do not go into effect until 2027 and beyond.